The next presenter is Dr. Rachana. She will speak on a role of color Doppler in the diagnosis of glaucoma in CKD patients. She is present? No.
Good afternoon, everyone. I'll be talking about role of orbital arterial color Doppler now. There are no financial supports and sponsorships. Introduction. Glaucoma is a neurodegenerative disease marked by the loss of retinal ganglion cells leading to damage of the optic nerve. While elevated intraocular pressure is a primary and most studied risk factor, glaucoma is multifactorial. Other contributing factors include the vascular dysregulation, reduced axoplasmic flow and oxidative stress, along with genetic predisposition. In recent advancements in diagnostic techniques such as color Doppler imaging have revealed that glaucoma patients have exhibited reduced ocular blood flow velocities compared to individuals without the disease. My aim was to analyze difference in orbital blood flow measured by color Doppler imaging in chronic kidney disease patients with and without glaucoma, to correlate between the RNFL thickness and color Doppler imaging findings in each group. It's a cross-sectional hospital-based study conducted between November to January. My inclusion criteria was patients diagnosed with CKD stages 1 to 5, aged 18 and older. Patients must be in a stable condition with no recent changes in medications that may affect the renal and ocular blood flow. Exclusion criteria were patients who have undergone glaucoma surgery within the last 6 months with significant ocular diseases, uveitis that may confound the Doppler results, acute kidney injury or rapidly progressing renal failure, systemic conditions that are diabetes, uncontrolled hypertension, severe cardiovascular diseases, non-compliant with study procedures. These patients have underwent a detailed vision evaluation, IOP, gonioscopy, fundoscopy. Optic nerve head assessments were done and were categorized them into glaucomatous group A and non-glaucomatous group B. Patients underwent color Doppler imaging studies of ophthalmic artery, central retinal artery and posterior ciliary arteries. Orbital blood flow was measured by evaluating the parameters like resistivity index, peak systolic velocity and end diastolic velocity. These findings were correlated with fundoscopy findings. SDOCT was done to obtain the retinal nerve fiber thickness to compare it with the color Doppler imaging findings. This is a fundus photo and RNFL thickness of a patient. Here my results were differences in the orbital blood flow between CKD patients with and without glaucoma. The cases with glaucoma have significantly lower PSV and EDV in ophthalmic artery, central retinal artery and PCA, suggesting that there is compromised orbital blood flow. The resistivity index differences are less significant, but there is a trend observed that there is reduced resistivity index in cases with glaucoma. These are few images of color Doppler imaging in cases of glaucoma. The optic nerve head and intraocular pressure differences, it is seen that IOP is significantly higher in CKD with glaucoma patients, supporting that there is an increased risk for glaucomatous progression. The CDR ratio is larger in the glaucoma group, reflecting optic nerve damage. Coming to RNFL thickness and comparison of CDI parameters, there is a significant positive correlation between RNFL and the peak systolic velocity and EDV velocity values in all the three arteries measured, which suggests that higher blood flow is linked to better optic nerve health. The resistivity index has a weak inverse relation, indicating that higher resistance could contribute to RNFL thinning. Here it summarizes that it shows a difference in intraocular pressure, cup disc ratio and orbital velocity, along with kidney function markers, that is serum creatinine and GFR and hemoglobin levels in cases of CKD with and without glaucoma. There is a significant rise in IOP. Coming to discussion, color Doppler imaging is a non-invasive tool for assessing ocular blood flow, particularly in systemic diseases like CKD. Our study demonstrated that there is a significant alterations in ocular hemodynamics in CKD patients, which is characterized by increased resistivity index and decreased end diastolic velocity in ophthalmic and central retinal arteries. These findings suggest that there is an increased vascular resistance and reduced perfusion, likely due to endothelial dysfunction, atherosclerosis and systemic hypertension, which is commonly seen in CKD. The notable findings of this study are progressive reduction in peak systolic velocity is seen in advanced CKD stages. Optic nerve hypoxia and retinal ischemia is seen. which may potentially contribute to further complications. The ocular complications such as hypertensive and diabetic retinopathy, ischemic optic neuropathy, and glaucoma-like changes. Here, there's a comparison between previously done studies and our study. In our study, we've seen that resistivity index, there is an increased resistivity index in ophthalmic artery and central retinal artery, which is already proven in previously done studies. But there's a difference that the primary pathophysiology, there's a same correlation that the primary pathophysiology could be systemic vacuolar compromise affecting ocular blood flow. And in a previously done study, it's ocular nerve hyperperfusion deficit and vascular dysregulation. I would like to conclude that color Doppler imaging shows that CKD causes reduced blood flow and increased resistance in eye vessels, raising the risk of optic nerve and retinal damage. These changes are similar to those seen in glaucoma. Color Doppler imaging could help detect eye complications early, highlighting the importance of managing blood pressure and circulation to protect vision in CKD patients. The limitations of the study were that it's a small sample size and the inter-observer variability between color Doppler imaging varies. These are my references. Thank you.
Thank you very much. Very excellent idea. But the color Doppler availability in our OPDs is very less.
Yes, sir.
So what's its clinical implications?
We have taken in an established setup where we have
otherwise the idea is very nice.
Ideally,
the idea
it is
is
not
very
an
nice,
OPD
but
procedure.
what is the availability and the clinical correlation and clinical application of this?
So maybe if we study more in detail, we can have a setup and we can refer patient for color Doppler imaging. Like both CKD and glaucoma have this micro.
You had availability of this color Doppler in your OPD?
Not OPD, sir. Ours is the medical college.
Okay.
I am a postgraduate.
Okay.
So in the medical college, associated with the radiology
that's
department.
Right. Color Doppler is with the radiology department.
Radiology department.
Radiology.
Sir. Radiology.
Okay.
Yes.
That's with the radiology department.
Yes, sir.
Okay. You have any questions?
It's okay. It's a non-invasive procedure, but of course, it's not that approachable for
yes,
every
the microvascular
centers and remote areas. It's only in the institutional areas or multi-speciality institutes that there is availability of color Doppler, and at that place also it is quite not so common everywhere. Secondly is the cost efficiency.
Yes.
It is quite a expensive procedure which may not be approachable for every person.
Yes.
So in that case, clinical acumen is the only thing which can be considered, of course. But of course, it's a nice, good idea. We must go ahead with this.
It was a very innovative idea and very excellent presentation.
Thank you, sir.
All the best.
Ocular blood flow, relationship of ocular blood flow with glaucoma and optic nerve ischemic changes is quite a burning issue.
Yes.
And it should be extensively studied. So one of the good tool it is. It should be studied.